Lung cancer is one of the most common cancers in the world. It causes more deaths than any other cancer. By diagnosis, the disease is often already in an advanced stage. Just 7% of patients survive 5 years from diagnosis. A diagnosis of lung cancer can be devastating. Feelings of isolation, lack of control, and being overwhelmed are common responses.
It was summer 11. I had a cold. The cold turned to a cough. I phoned up the doctor. The doctor said, well, there was a little bit of a rumble there, but I won't even bother to give you antibiotics, and that was that. A couple of weeks, maybe so later, I was talking to my sister about a pain in my back that I'd had. And the chest x-ray was done, I can remember, funnily enough, October the 31st. And then that came back with a shadow. It was a real sort of blow, a real blow. I was told that it was inoperable because of the position and really incurable. And that was basically it then. I started my journey.
But lung cancer is not just one disease. There are two main types of histologies: small cell lung cancer and non-small cell lung cancer, which can be identified by using a microscope. Non-small cell lung cancer, or NSCLC, is the most common overall. NSCLC can be further divided by histology subtypes, and adenocarcinoma is the most common subtype of NSCLC. Another way of categorizing NSCLC is by looking at the genetic profile of a cancer cell. There are a number of genes that may mutate, causing the cell to behave abnormally. EGFR is one such gene, and mutations can be identified with lab tests. Now that we've talked about the different types of lung cancer, let's talk about how lung cancer is treated. Standard treatments include surgery, chemotherapy, and radiotherapy, and more recently, new targeted treatments. Because prognosis is often so poor, recent research has tried to deepen our understanding of how cancer cells grow and function, with the aim of identifying new treatments that target cancer cells. With a better understanding of the different histology subtypes of lung cancer and their genetic profiles, a new generation of targeted treatments are now becoming a reality. One such targeted treatment is the investigational compound afatinib from Boehringer Ingelheim. The growth of healthy tissue is regulated by specific receptors. Mutations of receptors can affect important communications about growth, which can become uncontrolled and give rise to cancer. When a receptor called epidermal growth factor receptor, or EGFR, is mutated, it becomes overly active. It remains switched on to outside signals and sends continuous messages for the cell to grow and multiply. This out-of-control growth can lead to cancer. Afatinib binds to a family of receptors which includes EGFR and doesn't let go. It shuts down signaling from the mutated EGFR receptor, preventing the cells from growing and multiplying. Patients with lung cancer can be tested for the EGFR mutation to see if they could benefit from targeted therapy. Nintedanib is another investigational targeted compound from Boehringer Ingelheim. In order to understand how Nintedanib works, let's look at how tumours attract blood vessels. In order to grow beyond a certain size, tumours require a blood supply to provide oxygen and nutrients. As a cancerous tumour grows, it sends out signals that stimulate production of new blood vessels, which help the tumour to grow and spread. 3 major different signals are known to play a role in this process. Nintedanib is unique because it disrupts these 3 signals. As such, it starves the cancer of the blood supply needed for growth and metastases. With research now focused on the development of new targeted treatments for specific patient populations, there is hope for the future for lung cancer patients. Doctors are in a better position to choose options tailored for each patient, recognizing that lung cancer is not just one disease.